Holt-Oram is a syndrome that affects only 1 in 100,000 people in the world. Due to this fact, it's considered to be a rare condition. I have Professor Malcolm Logan on the phone today. Malcolm, what exactly is Holt-Oram syndrome?
Holt-Oram syndrome is a congenital disorder, and it's associated with mutations in a gene called TBX5, which is expressed in the early embryo in the developing forelimb and heart. And individuals with Holt-Oram syndrome who have a mutation in this gene, when they're developing inside the womb in utero, they develop defects in the heart and in the forelimbs. So we've been interested in the function of TBOX5 in normal embryonic development, and we've been particularly interested in its role in forelimb development. So right now we're trying to understand what TBOX5 does normally during formation of the forelimbs, and we're looking both at what's regulating expression of this gene, TBOX5 itself, as well as what TBOX5 is doing. So TBOX5 is a transcription factor, so that means it's a protein that can regulate the expression of or the activation of other genes. So we're really interested in understanding how this protein TBOX5 can be controlling the expression of other genes which are important in limb development. So we're trying to understand the pathways that TBOX5 is regulating during normal embryonic limb development. We want to understand that because this is the very processes which have not occurred properly in individuals who have Holt-Oram syndrome.
And is there anything else to know about Holt-Oram, or do doctors understand the syndrome completely?
I think there's plenty more that we need to know about Holt-Oram syndrome. I think from a clinical perspective, the heart defects in Holt-Oram syndrome obviously have the most acute problem, because those can have a serious life-threatening effect on the individual. The limb abnormalities, and even though they can be very profound and clearly be quite debilitating for an individual, they're not as life-threatening. So sometimes they are not given the same attention as the heart defects.
Not many families are affected by the syndrome, but when they are, it can turn their whole lives upside down. I spoke to Rebecca Hopkins, whose daughter, Frances Hopkins, has Holt-Oram. Becky, how has the condition affected your family?
It's always been called the family curse. And in the Hopkins side of things, it was not talked about, not discussed. So we knew nothing about it until I was 6 weeks pregnant, and I was extremely sick. I had hyperemesis, and I was just sick 24 hours of the day. And it wasn't till I was scanned that they realised that there was an issue. And that was when Dr. Ruth Newbury-Eckold became involved with the family. And at the 12-week scan, we knew she was affected because she always had her hand in the prayer position. So her hands were together, and she'd pull her right hand away and her left hand would automatically fall down. And every time she was scanned, they could see a change in the hands. That's the only reason we knew she was affected. And then it was from there that we had appointments with the genetic counsellors to actually work out what it was. My husband had conductivity issues of the heart, the bradycardia, the slow heart rate. He had no radius bone in his left arm, and he had no thumb on the left hand, and he had the flail thumb on the right hand, and his right arm, his radius and ulna, were fused. He also had concave chest. So when Frances was a baby, her head would sit in the hole in his chest. But other than that, he was really fit and very, very healthy. He played football and all sorts. Frances, she has the bradycardia, the concave chest. She has a shorter left arm. Her radius is shorter, but she does have the radius. On both hands, the radius and ulna are fused. And she's had polycization on both hands, but her hands are actually straight. The left one does curve slightly, but it's only noticeable when she reaches for things.
I also spoke to her daughter. So, Frances, how has the syndrome affected you personally?
A very slow heart rate. It makes me very tired very quickly, and I can't do as much as anyone else. I just need to sleep an awful lot. Also, my arms get very tired very easily as well, and my radius and ulna are fused in both arms, but my left is shorter. And yeah, when I get injured, it takes me a very long time to recover. It's about double the average. So when I break a bone and the doctors say it'll take 6 weeks to recover, I can guarantee it'll be about 2 months, 2 to 3 months before I'll even be back on my feet and be able to do as much again. Also, my thumbs, when I was born, my thumbs weren't viable, so I've had about 10 operations to make my index fingers into thumbs in both hands, or policizations, as you know, and then I've had tendons taken from all sorts of places to put in places that they shouldn't be, and I've had skin grafts on both hands as well.
And how have you found living with the condition?
I don't really know anything else. I've never known anything else, so to me it's normal, but it is difficult. I think to come to terms with the fact that it's not something that everybody has, and it's not your average asthma or hay fever that everyone can just go down to the GP and get a repeat prescription for, because medication has to be re-prescribed through consultants and things. And to me, it's quite strange to think that I'm one of the only people in the world to have it. And I guess since Dad's died as well, it makes me feel quite alone, because no one else in the family really talks about it, and whereas we'd kind of group together and side with each other and say, oh, I found this really difficult today, it's difficult not to have that person who understands when you can't lift a kettle or a cup and it just falls to the ground and smashes, or when you walk into a door and everyone else is like, oh, get over it, and you've actually fractured your elbow, and just random things like that make it more difficult. And the fact that the heart condition obviously isn't visible, so a lot of people don't believe that there's anything significantly wrong.
These days there are many surgeries that Holt-Oram patients can have as a young child. Surgeries like policization and the corrections to the heart are done when you're born, and sometimes even in utero. Barbara Parks, who's 87, didn't have the same opportunities back in the mid-1900s. Barbara, how severe is Holt-Oram with you?
It's quite severe in my arms. I've never been able to raise my arms to the full height like most people. As a little child, it was very painful to move my arms, but as I've got older and done more exercise, like aqua exercising, it's helped a lot. That I can lift them a little more. But now, at my age, it's getting back to being what it was when I was a little child. I haven't got the good reach that I had. That's as far as the arms are concerned. The heart, at my age, they didn't have the discoveries that they have now. And until they brought out the way to do the angiogram, they just knew something was wrong with my heart, but didn't know what. So I have had that looked after. Well, the biggest thing, this procedure that I have had, of course, was the correction to the heart. I had atrial septal defect, which the blood that had gone through the lungs was mixing with the blood that hadn't been oxygenated. And that was corrected when I was 35. That was when they found out what it was. Then later, my left arm, which was the one I used all the time, I had a shoulder operation because the ball and socket had become very jagged with overuse. So they put a steel ball with a shaft down into the bone of my arm, and that certainly took the pain away. It was not quite as much use in it, and lifting, I didn't have as much range of motion, but I had no pain, so it was certainly worth the surgery. Nobody knew about my heart condition. They knew something was wrong, and I used to say when I would lie down that I felt I was choking, and I really needed to be raised a little with my head so that I would breathe easier. So in things like that, now they would know what was wrong and be able to correct it. But I had to wait till I was 35 before I had the heart defect looked after. But I never have had anything to do with my hands. I just don't have thumbs. I can't rotate my hands. I don't have a radius, so I can't twist my hands palm upwards. And nothing has been done about that. They did try at one stage. They went in, but they found that it was just one solid bone mass, and they didn't want to take away the use I already had, so they left it alone.
And does it affect your daily routine in any way?
Yes, it makes it very inconvenient sometimes. Getting up and getting showered and getting ready for my day. By the time I do that, I very often, more often than not, like to sit down with a cup of coffee and catch my breath, because it's quite an effort to do those things now. But that's because, as well as Holt-Oram, I have some arthritis and things, and that makes it a little bit more difficult.
Nowadays, you can get pre-implantation genetic testing before pregnancy. Obviously, this wasn't around when you were trying for your children. Were you worried about passing the condition on?
Yes. In fact, I was so worried I felt I should look into it as best I could before I gave an answer back to the man that was wanting to marry me. I went to see different surgeons in Montreal, where I was living at the time, and they all said at that point, now we're going back a long way, mind, I was 22 and 87. Well, you know how long ago that was. But the 3 doctors I saw said, If it started with me, where did I get it from? Nobody knew, and it was the likelihood of it happening again was very, very slim. So I had my first child. He was a boy, and he was fine. He didn't have Holt Orams at all. So I wasn't really too concerned when the second one was coming. But then, unfortunately, she did have it. But I wouldn't be without her for the world.
That's all we have time for today. For any other information regarding Holt Oram syndrome, please visit our website. It's holtoramandyou.co.uk. I've been Rhiannon Lucas for HOS and You.